All right, so again, welcome back to the continuation of your pre-recorded lecture on microscopic examination of urine. And this part, what we're going to discuss are the third constituents na of your urinary sediment, and that is your crystals, okay? But before we continue the guys, something I forgot sa casts na to na discussion, the order of degeneration, okay? Meaning, unsay parang steps sa casts in a way, generally. So we'll start first, of course, una juday ng hyaline. Okay? Always take note. Mugini first na type of cast, hyaline. Okay? Followed by your cellular cast. Okay? So, of course, cellular cast usa. So, diri na siya either RBC ba, WBC, etc. Okay? Followed by your coarse granular coarse granular, di ba? So, if mo disintegrate na yung cellular cast, magka-coarse iyang appearance, so coarse granular. And then finally, of course, di ba, na-mention to na, as the granular cast further disintegrates, mas soften or mas smooth iyang appearance. So after coarse, you have fine granular. Okay. And of course, ang pinaka-last na type of cast, is your waxy. Okay? Muna yung pinaka-last. So generally, muna siya gina-follow na types of casts or the order of the generation of casts, okay? From the pinakauna, the template, which is hyaline, okay? Next, of course, cellular. So, different cells, kung unsa man gani nasa tubule, ato na time nag-create ang cast, ma-incorporate dito. So, muna cellular cast, could be RBC, WBCs. And then, of course, if ma-prolong siya o stay dito sa tubules, mo-disintegrate, mahimo siyang coarse, granular sa una, coarse. And then finally, fine granular. And then last is, of course, waxy cast. Okay, so that's the order of degeneration. Degeneration meaning order of life cycle in a way of a cast. Okay, or the different types of cast na ma-experience or ma-create, okay, over a period of time. Okay, but starting sa hyaline, last gyud sa waxy. Okay, and a last thing yun, mga additional lang yun, kaya mga karon pa na ako na remember, sorry naman. It's all coming back to me now. Your bubble cell, okay. What do you mean by a bubble cell? A bubble cell is an RTE, okay? RTE siya na ay mga vacuoles, with vacuoles. Pero ang sulod sa yung vacuoles, dili lipids, okay? Alright, so bubble cell, RTE with non-lipid vacuoles, or kaya if lipid ang naas RTE, unsa ganito siya, oval fat bodies, okay? But a bubble cell, RTE with vacuoles na dili lipid ang sulod. Okay, please take note. Mga additional na lang, write na lang sa other sa inyong notes on RTE. Okay, all right. Sorry naman. All right, so now we'll go now to the third constituents of your urinary sediment, and that is your crystals. Okay, now your crystals can be classified into normal. Okay, we have this uric acid, amorphous urates, CaOx, amorphous phosphates, triple phosphate, calcium phosphate, calcium carbonate, and ammonium biurate. And of course, we have the abnormal crystals. Excuse me. All right. So you have A, B, C, D, and E until H gyapon. So most of the time, your crystals na makita nato sa urine, they are of non-pathologic significance. Yeah, but we have to look for these type of crystals also, which are your pathologic yun. And some of your normal crystals also can indicate another type of disease or another disease that the body is experiencing. Not necessarily disease sa kidneys. It could be disease of another organ ba, or an elevated concentration of an analyte sa imong body, etc. Okay, so these are again the different types of crystals, and we'll go individually ani nila. So first, we'll start what are crystals. Again, they are a result of the precipitation of urine solutes, diba? We mentioned that your urine is not pure water. That's why atong SG, it's not 1.000. Na yung mga dissolved solutes, ana, diba? And the primary organic is urea, and primary inorganic is chloride. Now, if the urine specimen is subjected to different environment, may it be a pH of acidic or alkaline, or a temperature na low or high, then these solutes tend to precipitate. Okay? And these solutes can be of wide range of substances. May it be from normal na imong ginakaon, normal metabolic byproducts, may it be sa mga medications na imong ginainom, or and some organic compounds that are also found in the body. Okay? When we say iatrogenic compounds, again, medications. Those are the compounds, breakdown products from the medications that you intake. Okay? Muna iatrogenic compounds. Now, usually appearance, they are geometrically formed structures or pwedeng amorphous. There are crystals that they are really definite ilang structure, like makita yun mo ilang shape inana. But there are also crystals na amorphous, meaning walay definite na shape. Okay? Alright. Amorphous. Wala na siyang mga pulverized na powder or something. O mga, what they call this, mga grains of sand. Ay, yes, Manila Bay, char. For my mental health. Okay? So, wala na siyang mga grains or wala ka ng mga granules inana ba. So, wala siya, walay definite yun na shape. Okay? Alright. And we have different factors affecting solubility. Number one is, of course, for temperature. Your solutes or your crystals, they precipitate at low temperatures. That is why, di ba, na-mention na to, when your specimen is refrigerated, amorphous urates, di ba, or amorphous phosphates or amorphous urates tend to precipitate because they are at low temperature. That is why, ato sanang ipa-warm at room temperature before we process, di ba? Okay, these crystals may hinder our analysis of our urine, di ba? Okay. And for solute concentration, of course, if your urinary solute increases, they tend to be precipitated, di ba? Remember mo sa principle sa saturation in your general chemistry, di ba? If a solution, if maabot na gani sa solution ang murag threshold in a way, or kung asa na siya kutob, asa na siya taman na concentration sa solutes, diraragyo na siya, meaning equal ilahang, what do you call this? Nalimot ko sa term. Basta equal ilahang solubility in a way. But if more than that, then mahimo na siyang saturated solution. What happens is mo precipitate na ang kato ng mga substances, right? And if more than pagyud ana, di ba, may mo na siyang super saturated. I don't know if makadamar mo sa Gen Chem ana. But muna siya point here, no? As more solutes are present, they tend to be precipitated, okay? Their solubility in the solution decreases, okay? Alright, so muna may muna silang crystals or ma-precipitate na sila. And last is, of course, pH. We determine, aside from we classify crystals into normal and abnormal, we also classify them on the pH of urine kung asa sila makitaan. Okay? Na yung mga crystals na makitaan sa acidic, na yung makitaan sa alkaline. Now, most of your abnormal crystals, they usually precipitate at the acidic urine. Okay? Acidic urine. Maliban na sa usa ka imuhang normal crystal na CaOx or calcium oxalate, makitaan siya both in acidic and neutral urine. Okay? Ang CaOx. Alright? Or calcium oxalate. Okay? Alright. Okay. Yeah. So, muna siya yung point. So, these are the different factors affecting solubility. Okay. Alright. So, now, we'll start first with the normal crystals. So, as you can see, again, uric acid, varied na siya usually. It's either acidic or alkaline. But these are considered to be normal. When you see acidic, usually, kato na mga uric acid, mga urates, mga ure, usually those are acidic. Ang alkaline kato mga phosphates, carbonate, tinana gani mga biurate, di ba? As you can see, actually, akong pag-remember, ani, kinsay acidic, kinsay alkaline na urine, ma-remember na ako akong Gen Chem gyapon, yung mga carbonates, phosphates, I tend to look at them as mga basic yun. Munang alkaline sila makitaan. And then mga acid, urates, di ba? Uric, inana. Muna siyang acidic, usually sa acidic urine makitaan. Okay? Alright, so we'll start first with the normal crystals. First one is uric acid. Of course, your uric acid is considered to be the most pleomorphic. Okay? The most pleomorphic. What do you mean pleomorphic? It can assume, di na mag-assume kaya masakitan, pero si uric acid, ganun siya mag-assume. It can assume a lot, as in like a lot of shapes. Okay? Pwede siyang daghang shapes. Dili lang siya limited to rhombic, four-sideds, wedges, rosettes. Even Henry's describe uric acid as lemon-shaped. Okay? Lemon-shaped ang uric acid. Okay? That's according to Henry's. Alright. So, again, uric acid, most pleomorphic, di ba? In your bacteriology, I don't know if ano na mo ang pleomorphic. When you say pleomorphic, it can have different shapes. Okay? Dili lang siya stagnant or stationary in one shape. Okay? Para siya sa uric acid. It can assume different shapes. Alright? But, generally, iyang appearance is rhombic, four-sided plates. So, rhombic. Rhombic. Masyag diamond. Pero four-sided plates. Okay? Alright. But again, according to Henry's, pwede siyang lemon-shaped and different shapes. Alright? That's for uric acid. Yeah, here's some pictures. Diba? Four sides, rhombic. Wet stones. Yeah, wet stones. Sana all wet. Charot. Yung color is again yellow-brown. Alright? And yung significance, leukemia, Lesch-Nyhan syndrome, and gout. Now, anong leukemia? Okay. Your uric acid is again a product of purine metabolism. Okay, di ba? And purine metabolism is part of your nucleic acids, di ba? Or nucleotides. Now, leukemia, remember, leukemia increase imong WBC. So therefore, taas po ang mga dead cells na ma-produce. So therefore, daghang sources of purine. Kaya di ba, your nucleic acids are found in cells, in the nucleus of cells. Now, since in leukemia, you have a high turnover of cells, mga namatay because, of course, di ba, malignant proliferation of your white blood cells. So, daghang mga white blood cells na namatay, daghang purine na ma-release, daghang pong uric acid na ma-form. Okay? Remember? Because uric acid is a byproduct of purine metabolism. Okay? Okay na na. Maramoy in clinical chemistry. Okay na na. Lesch-Nyhan syndrome, encountered Japan in clinical chemistry. Lesch-Nyhan syndrome is a deficiency in the enzyme known as HGPRT, okay? Or hypoxanthine, oh my gosh, ang spelling. Hypoxanthine guanine phosphoribosyl transferase. Okay. Okay, all right. So HGPRT, hypoxanthine guanine phosphoribosyl transferase. Now, what does HGPRT do? Okay, now, your HGPRT, what happens is, iyang buhaton is, your uric acid, in the presence of HGPRT, iyang i-convert to allantoin. Okay, muna siya yung further breakdown product of uric acid, allantoin. Okay? And in the presence of HGPRT, iyang i-convert ng uric acid to allantoin. Now, if wala ni siya, of course, stagnant rang uric acid, magsige ra dyan po, taas ra po ni mohang uric acid, walay mo convert niya to allantoin. So therefore, mo nang makakreate siya mga crystals or taas imong uric acid concentration. And gout, of course, gout is the deposition of uric acid sa imuhang mga joints. Okay, that's gouty arthritis. Just because increase imuhang uric acid concentration in your blood, that's why ma-deposit siya in the joints. Okay, all right. So because of these diseases, muna siya possible sa uric acid. Alright? But there are times po na non-pathologic like taas or ang uric acid sa patient, mo-appear na siya sa kidneys, sa urine. Okay? Alright. So again, that's for uric acid. Alright. Okay. Again, HGPRT ha. I'm not quite sure lang. Medyo basin sayop ko sa iyang function. Pero appeal dyan siya sa metabolism sa uric acid. Okay? And the further byproduct of uric acid is allantoin. Okay? Munang list, dali na siya ma-remember kina ako yung mga batchmate na sa imong ngalan. Di ba si akong batchmate na si Alan. So, allantoin. Okay, alright. That's for uric acid. Most pleomorphic ha, it can assume different shapes. Alright. Next one is amorphous urates. Di ba? Amorphous urates, we remembered dinani siya. When you say amorphous, diba, so you can see murag kumpul-kumpul ra siya, murag mga murag siya kanang powder na form or murag gakumpul-kumpul sila. So muna siya points amorphous. All right? So yellow-brown pero observed po in refrigerated specimens, diba? We have a pigment sa urine na mo attach sa amorphous urates sa refrigeration during refrigeration muna na pink sediment, diba? Pink sediment, that's your uroerythrin. So muna siya na crystals yung attached siya under refrigeration. Okay? Alright. So, amorphous urate. Still, urate. So, mga na uric acid, urate. So, munang, it's acidic kay mga urate. So, yeah. Alright? Okay. Pero yung color is about brick dust or yellow-brown. But again, if refrigerated specimens, mo attach ang uroerythrin na pigment niya, munang na pink sediment on refrigerated specimens, diba? That's because of amorphous urates and uroerythrin. But again, that's just normal. Alright? Okay. Ayan. Next, you have your CaOx. Your CaOx, again, your calciumoxalate, again, may appear in acidic or neutral urine. So, gibutan na siya this acidic urine. Appearance is octahedral envelopes, or that's what we call your envelope-shaped na crystal. And that's known as your dihydrate. Okay, so your dihydrate or your wedellite. Okay, muna siya other name sa wedellite. Sakto ba akong spelling? Teka, wait. Let me check my kodigo sa spelling lang. 1L lang. Okay, sorry. Baka na siya kung spelling rin eh. Okay, wedellite. Okay, dihydrate. And your monohydrate is oval or dumbbell-shaped. Okay? And that is known as your light. Murag mo niya ang double L. Again. Sorry guys, baka na siya kung spelling. Yeah, wedellite. Okay, so how do I remember? D, daghang D, wedellite. So, dihydrate. And then, ang M, mura siya W na gibal, ay, mura siya ang W kay murag M nagibali, so monohydrate wewelite. But if kabalo nakaaning daghang D, it's wedelite lang. Of course, imperative na press the buzzer na monohydrate is wewelite. So that's just other names niya, guys. So sayo mo gawas mo gud sa boards. All right? So again, Caox, very significant, distinct iyahang what do you call this? Shape. Again, if dihydrate siya, the most common is your envelope shape, all right? And oval dumbbell, Akit ako sa video ani. Anyway, oval or dumbbell, it's your monohydrate or your wewelite. So here example of pictures, very amazing. So this is the most common, di ba? Meron siyang envelope shaped. This is your wedelite or dihydrate, and this is your monohydrate or wewelite. Now, unsay significance niya? Usually color is colorless, and ang significance niya is kanila ethylene glycol poisoning. So ethylene glycol is usually makita siya sa ginagamit siya for anti-freeze ay mong refrigerator man ito. And usually if ang children daw makainom ay maramagod siya it's sweet. It tastes sweet mandagay. Munang pwede siyang ethylene glycol poisoning. And if the patient or if the child has intaken or has drank ethylene glycol, makita sa ihi ang monohydrate na calciumoxalate. Okay? All right. That's again ethylene glycol poisoning. Now, another significance sa imuhang kaning Caox. Your Caox manggod is the most common. Caox, the most common constituent, okay? Most common constituent of kidney stones. Okay? Or renal calculi. Okay? Renal calculi or kidney stones. We'll have a different discussion on renal calculi after sa crystals. But it's the most common cause of your kidney stones. Okay? And aside from that, your Caox also can be due to high intake of foods na taas og oxalic acid. Example, asparagus daw, sa mga beets, or also ascorbic acid. Because ascorbic acid, ang further breakdown product niya is oxalic acid. Okay? And in the presence of calcium, mag-combine sila, mahimong Caox. Munang, usually daw, 500 mg of ascorbic acid ragyod imuhang kada adlaw. And if more than that na, then basin at risk ka of Caox na stone. Because again, ascorbic acid is ascorbic acid's further breakdown product is oxalic acid or oxalate. Okay? All right. And according to Henry's, patients with cystic fibrosis, ilahang intestines, they don't have the normal flora, Oxalobacter formigenes. And by the name itself, oxalo, it's associated with the Oxalobacter formigenes. It breaks down oxalate from the food that we eat. So if wala ka ani na bacteria, then mag-accumulate tayo mo oxalic acid or oxalate, munang prone ka to calcium oxalate po na crystal formation. Okay? That's for cystic fibrosis patients daw, according to Henry's. They lack the bacteria, normal flora sa intestine, Oxalobacter formigenes. Okay? Which tend to make them prone to Caox formation of crystals ba. Okay? Alright, that's for calcium oxalate. Basta gani, dihydrate, the most common, envelope shape, no? Also known as your wedelite. And you have monohydrate, dumbbell shape. Okay, dumbbell. Dumbbell oval shape. Usually seen in ethylene glycol poisoning, anti-freeze poisoning. And unsay ang other name? Wewelite. Okay. Alright. Now we go to your alkaline urine. First is, of course, your amorphous phosphates. Granular gyapon siya, may be seen following refrigeration, still the same. No, mura siya mga abug-abug or something. White, colorless, and white, colorless. Mura na siya. Again, amorphous phosphates, quite a normal constituent of the urine gyapon na crystals. Next, yung calcium phosphate, not frequently encountered. Flat rectangular plates or thin prisms, often in rosette. So rosette meaning, mura siya rosette. Parang paganyan. Basta murag flower ang shape, basta rosette. Okay? Calcium phosphate, ana. All right. Calcium phosphate is also known as your apatite. Okay? Calcium phosphate can also be one of the most common na constituents of kidney stones, ang calcium phosphate. Pero ang pinaka-common yun is Caox, calcium oxalate. Okay? All right. So that's calcium phosphate. Apatite. Okay. Again, colorless. Next, we go for triple phosphate. Ayan, pinaka-common. Most distinct yapon. Distinct po yung appearance, your coffin lid appearance. Okay? Feathery appearance if disintegration na siya. And na po siya ay prism shape. Please take note of its other names, struvite. Ayan, kay nigawason na sa boards of 2017. What is the other name of triple phosphate? Dagay ito? Sa CM na boards, struvite. Please take note, struvite. Pero yung iyahang long name is ammonium magnesium phosphate. So triple phosphate, ammonium magnesium phosphate. Usually see niya siya in, so as you can see, di ba, coffin lid, commercial coffin lid, or prism shape. Okay? Alright. Usually none, it's not significant, pero associated siya with urease producing bacteria. So kana mga urease producing bacteria, you'll know that in your bacteriology. But a very good example is Proteus pa rin. Okay. So, kanisa na ng mga organisms, Proteus, if your patient experience UTI caused by Proteus, pwede siyang triple phosphate because it's associated with urease-producing bacteria. And triple phosphate also na siya characteristic na kidney stones also. Pwede po siyang source of kidney stones later sa atong discussion on renal calculi. Okay. Alright. That's triple phosphate. Okay, so we'll continue now to our normal crystals. So we're now in the alkaline urine type of crystals. Next, we have your calcium carbonate. Your calcium carbonate are dumbbell usually. Dumbbell or spherical shapes make clump, resulting in its appearance as like amorphous material. So here, usually wala ni siya clinical significance. Yeah, colorless pa rin. But please take note lang na if ang calcium carbonate butangan o glacial acetic acid or acetic acid na ay gas formation na may tabo. Gas formation or effervescence. Okay? Alright, mura na siya for calcium carbonate. If adanin mo siya acetic acid, mo produce a gas. Okay? Gas formation or effervescence. Okay? Alright, that's for calcium carbonate. And last one in your normal crystal in alkaline urine, you have ammonium biurate. And ammonium biurate, pinaka-distinct Japon is your thorny apple appearance. Ayan. So, basta gani, thorny apple appearance, mga nana, envelope shape, coffin lid appearance ng mga crystals, press the buzzer na kaayo. Very common. Very, easy. Huwag nang mag-isip. My gosh. And usaan na is, again, thorny apple. Basta thorny apple, it's ammonium biurate. Okay? Kaya nasa yung mga spicules or nasa yung mga protrusions outside. Namara siya apples na thorny. Okay? And usually makita siya in old specimens. Aside from that also, clinical significance niya is, here, example, di ba? Of your ammonium biurate. Nasa yung mga murag spicules, right? Yeah. Mura siya, what's yung appearance? Yeah, basta apples na murag na yung mga thorns sa kilid. Alright? Inanipod. Alright? Usually seen again in old specimens. Murag, especially if taas ang uric acid. Okay? So yellow-brown and none yung clinical significance but can be associated also with urease-producing bacteria if your patient is suffering from UTI caused by these bacteria. So mga Proteus, Providentia, okay? Alright. And your ammonium biurate, manggod, is if imo na siyang adan og acetic acid, it will convert to uric acid. Okay? Alright. If na ay acetic acid ni siya ha, acetic acid. Okay? Alright. So, again, not clinically significant kaayo. Maybe seen lang in mga infections caused by urease-producing bacteria. And again, isang characteristic na appearance, thorny apple. Thorny apple appearance. Wag na mag-isip. Thorny apple appearance. Alright. So those are for your normal crystals. Now, we go now to your abnormal crystals. As you can see, as I've mentioned, most of your abnormal crystals, if not all, they precipitate at an acidic pH. Okay. Alright. So we'll start first with your cystine crystal. Your cystine crystal can be seen only in diseases, in a disease known as cystinuria, okay, which is an inborn error of metabolic disorder pa rin. So, it means na naay pagpanganak sa baby na siya enzyme deficiency na ginagamit for cystine metabolism. So, wala siya ato na enzyme. Therefore, taas siya cystine levels in his or her blood. Okay? Alright. So, again, it can be colorless and, inherited cystinuria. As you can see, hexagonal plates, di ba? Unsa yung same appearance na crystal? Same siya appearance sa uric acid, right? So, how do we differentiate cystine crystals o uric acid? Now, for uric acid, always take note, it's highly birefringent, meaning muscatter siya light, okay? Highly birefringent. Ang cystine is non-birefringent. And we have a test for cysteine. You have cyanide nitroprusside reaction. Okay, cyanide nitroprusside reaction. All right? And cysteine is positive. And uric acid is negative. Okay? So if you want to differentiate the two crystals, all right, you could opt for birefringence. Uric acid is really birefringent. Muscatter siya sa light. Cyanide nitroprusside reaction, positive ang cysteine, negative ang uric acid. Okay? All right, that's for cysteine. So again, seen in inherited cystinuria, an inborn error of metabolism disease. Okay? All right. Next, we have cholesterol. Okay, now your cholesterol is rarely seen unless it's refrigerated, because if refrigerated siya, mutapot ang or mugawas ang fat globules ba to? Ang explanation sa Strassinger. Please take note, characteristic po siya. Rectangular plate na notch na po. Ikaduha na notch. Yes, sana. Okay, so na siya notch corners. Kana good guys. Or ano siya, describe po siya as staircase. Saan niya akong whiteboard marker? Staircase pattern. Okay? Alright, staircase pattern, notched corners. So, rectangle man siya, okay? Pero na siya notch. Ayan. Na siya notch. Okay, kani ang pasabot sa notched corner. Inana iyahang crystal sa cholesterol. Okay? Alright. So, staircase pattern or notched corners, rectangular plates. Okay? Alright. So, yeah. Here's an example. Yes, kani mga, yeah, kani notch there. Meron siyang staircase, right? Staircase. And then ay mga notch sa kilid. Notch, yes. Sumuka sa notch. Okay, all right. Okay. It's colorless and usually significance niya is nephrotic syndrome. Now, you always have to look Japan into its clinical findings. Aside from crystals, always look sa yung chemical pod, protein, diba? Other cells, oval fat bodies, inana para may kayong kang nephrotic syndrome. Okay? Alright. So again, that's cholesterol, staircase pattern, or rectangular plate with notched corners. So sa ito na notch pod ganina, fatty cast. Diba? As you can see, usually kato mga fats ang notch. Huh? Ang bastos. Oh my God, my mind. Alright. Next, we have, starting from this, we will now have what we call your liver disorder crystals. First is your leucine. Ang for leucine lang, guys, na siya concentric circles. Okay? Meaning, concentric circles. When you say, like, one circle, and then another circle, and then may paana. Okay? Alright. So, that's your leucine. Okay? Spherical concentric circles. Muna na siya i-take note na description sa leucine. Okay, yellow to yellow-brown, seen and again, liver disease. Okay, leucine. And you have, next you have tyrosine, another crystals for liver disease. Again, fine needles that form clumps or rosettes. So, marashag sea urchin, right? Yeah. Pero clumps siya na needles na mo form og rosette or clumps. Okay? Again, seen in liver disease. All right? And the last crystal for liver disease is, of course, your bilirubin. Still the same clump needles or granules. As you can see, meron siya po siya sea urchin, pero ang color lang niya is really yellow. Okay? And asa siya makitaan sa liver disease. So, unsa ganito itong mga crystals under liver disease, you have BLT. So, I know I've introduced this mnemonic in Intro to Micro, di ba? My God, such a memorable class. Maglantaw na ba siya, Ani? Okay, so, BLT for micro, these are your spirochetes, di ba? For micro. You have Borrelia, Leptospira, and Treponema. For CM, BLT is the liver disease crystals. Okay? So, sa meaning sa BLT, bilirubin, leucine, and tyrosine. So, silang tulo ang mga liver disease crystals na to. Okay? Alright, please take note. Do not mix the two, okay? If BLT sa micro, the spirochetes. Kung sa CM, BLT are the crystals in liver disease. Okay? Alright, okay. So, anong tyrosine and leucine usually ang liver disease? Because again, these are amino acids. Alright? And amino acids, usually, they're all synthesized in the liver. And, you know, liver plays an important role in mga pag-synthesis of proteins, amino acids. So, if daw mo liver, of course, dili siya ma-form. Pero, mag-release noon, ma-leak noon ito yung mga na-form na amino acids into the bloodstream. Okay? Resulting to the formation of the crystals. Okay? If I'm not mistaken. Alright? Ayan. And next, you have sulfonamides. The next types of crystals usually caused by the medications that you intake. Okay? Number one is sulfonamides or sulfa drugs. Still mga clumps or rosettes, di ba? Yeah, usually gikan ka, if nag-inom ka og mga treatment for UTI and you have poor hydration or wala kay kani-hydrate, okay, wala kay water nagiinom, then na possibility na mo precipitate ang sulfonamides na imong intake. Pero most of the drugs daw sulfonamides karon kay mo ano na siya, soluble na daw sa water and also yeah. Again, seen siya in infection treatment, usually UTI, using these antibiotics. Sulfonamides are antibiotics, okay? All right, so fine needles, na clumps or rosettes. Always look at, example, if hatagan mo case study, always look at the situation of the patient, unsay presentation niya. Like history, example, history, drug intake history. So ni-mention na sulfonamides. O possible na ang crystals na nakita na clumps or rosettes, that could be sulfonamides. Okay? All right. Next, you have ampicillin. These are needles, again, that mo form siya bundle following lang refrigeration. So before sa refrigeration, wala kayo siya, individual ra sila. After refrigeration, kay bundles na sila or nag-form na sila into bundles. Again, colorless, yung significance is infection treatment. Ampicillin, example, mga penicillins, inana. So, yeah, depende na siya sa medication na imong giinom. Also, depende po sa hydration. So, it's important na if mo inom ka mga tambalin, you really hydrate well. Okay? Minom siya ka much water. Okay? Alright. And last one is your radiographic dye or contrast media. Now, yung appearance mo is similar to cholesterol. And when do we see this? Na yung mga radiographic procedure na mo inject sila og pyelogram, okay? Intravenous pyelogram. So what you do is mo appear noon tong mga mo appear tong kaning radiographic material na ilang gi-inject sa urine. Okay? And ang appearance pag yun niya is same sa cholesterol. So how do we differentiate? Again, you always have to remember that cholesterol crystals again are notch pattern, di ba? And usually maseen siya in anong staphylococcus ang naman? Makita siya in nephrotic syndrome. So if you're suspecting of nephrotic syndrome sa cholesterol crystals, then always look again, as I mentioned, for different parameters or different results sa urine na makayon ka na nephrotic syndrome. So massive proteinuria, sa pamanto, oval fat bodies, mga yun, okay? And for radiographic contrast media pod, if the crystals are radiographic contrast media, you always have to look pod at the SG. Because if greater than 1.040 ang SG, then that is caused by the radiographic procedure. Okay? So, munang it's important na you look into the SG if nag-wonder ka if cholesterol ba or radiographic contrast media imuhang crystal. Okay? Since same sila og kanang appearance. Okay? Alright. So, mura na siya. Okay. So, that's the discussion on crystals. Okay, for our next part, we'll discuss about renal lithiasis or kidney stones. Okay, because again, crystals form a vital role also in the formation of kidney stones. All right. Okay, so mura to siya. Thank you. See you in our next video. Okay.